It's painful to see students not able to stay in day school because of their mental health issues.
People weren't talking. It was very stigmatized.
We've seen mental health needs skyrocket.
This is a time of crisis for young people.
Everybody is struggling, and these issues need to be addressed. 8 years ago, my daughter was struggling with some mental health issues. It was through being open about her journey that other people came to me and started sharing their stories. And I saw that there was such a need in the community. Our foundation, the Ruderman Family Foundation, started to take this issue on. Around the same time, Gateways also noticed the need. We were able to come together and bring some support into the day schools.
At Gateways, we've always worked towards and believe in access to Jewish education. And mental health can be another barrier to Jewish education. When students are struggling with mental health issues, it affects their academics. And so we felt that this was really another area that was important for us to address in the same way that we address speech and language needs, occupational therapy needs, learning needs.
The pandemic brought about a lot of unpredictability. And I think that's really impacted our students in terms of their needs to feel safe, supported, and have a stable environment. We've seen a lot of anxiety. We've seen staff and faculty become more stressed.
We're living in a time where kids' mental health is more visible than any other time in my career. We're now really coming to understand as educators in a much deeper and more profound way the relationship between mental health and learning for kids.
Because of our partnership with all of the Boston area Jewish day schools, Gateways is uniquely positioned to see the themes and needs across the schools and then intervene with different initiatives and programming that can help support those needs.
Addressing mental health needs in day schools is the most important thing. For students to be able to learn and focus in school, they have to first have their basic needs met. They need to feel like they're connected, they're supported, they belong, and that somebody's there for them.
We look at the whole child and all of the child's needs. We have a grant through the Miriam Fund where we've been offering webinars on different mental health topics, having a young person who has lived experience with whatever mental health topic we're discussing share their personal story. We've brought training into the day schools to train teachers to build their capacity to be able to support students since they're really on the front line with those students.
Gateways has been the driving force in helping us create a framework for our mental health services.
Gateways has been the backbone of the support that we've been able to provide for our students. We want to support the whole child. We want to support every member of our community at every stage of life. And that's part of the beauty of Jewish day schools is it creates that community and that support system and the network that whenever it's necessary, we're there to help.
We partner with the Becker Foundation and with the Brookline Center for Mental Health so that we can bring therapists into the day schools because there's been such long wait lists out in the community.
Schools play an important role in the lives of kids, and it's an opportunity now for schools and families to partner together.
We were really interested in helping to support the landscape of mental health access, particularly in Jewish day schools. We knew that Gateways had the relationships, had the expertise into the day school systems to know what would be the most impactful intervention.
There needs to be an integration between what's happening at home and what's happening at school. Mental health is about resilience, and mental health is about the strategies for navigating one's life. And mental health is about scaffolding and understanding who your supports are and being able to reach out to them. What's really important is to be able to provide kids with what they need in order to grow and be the best that they can be.
Gateways has been amazing in providing resources, a behaviorist, a mental health provider, a consulting psychiatrist.
We also are piloting a bridge program in 2 of our schools for students who have more significant mental health needs.
Our team from Bright helps schools transform the way that they work with kids who have experienced serious mental health disruption. Every educator I know wants all kids in their school to be successful. And if we're going to make that a reality, We need to plan our schools for all kids.
Gateways has been instrumental in helping us create our Therapeutic Learning Center, which is a place that many students now access to help them get through the more difficult times that they're experiencing.
We want all parents to be able to send their children to the schools of their choice and be able to have the schools be equipped to meet the needs of their children. Our goals when we think about mental health are to increase awareness and decrease the stigma.
Part of the work moving forward on mental health in the day schools is really thinking, how can we be creating multi-tiered, comprehensive systems of mental health support on a small but powerful and robust scale.
When we think about mental health funding, particularly in the Jewish community, we see day schools as a really good way to intervene as far downstream as we can, to really help kids, help families get the support that they need to grow into well-adjusted, healthy adults who are also Jewishly engaged, Jewishly committed. We really want to see a beautiful, vibrant, inclusive, welcoming Jewish community. We see day schools as a really key lever to achieve that.
I'm so grateful for our partnership with all of the local Jewish day schools.
I want to thank Gateways for helping to provide for the needs of the community in this very unique and special way.
When a student is struggling with mental health needs, that student is somebody's child.
It's a very difficult journey where you don't always see the light at the end of the tunnel, but it gets better.